and let me thank you all of you for watching my video. As you all know that this is Dr. Elizabeth Dentistry and I am back with a very interesting topic guys, Leukoplakia. So let's get started guys. How excited are you to actually begin with this journey guys? So first of all guys, if you watch this video then please like this video. If that sounds like something could help grow your knowledge then make sure to join me and please subscribe to get the latest video. Now let's start with leukoplakia guys. Started. First of all, definition. Okay, a white patch in the oral cavity which cannot be scraped off and which cannot be characterized clinically or pathologically as any other disease. It means, guys, according to WHO, the term leukoplakia should be used to recognize white patches of questionable risk having excluded other known disease or disorder that carry no increased risk of cancer. Okay. Now come to classification. Ready? Are you ready guys? Based on the clinical type, it is divided into two types, homogeneous and non-homogeneous. Then further it is divided into based on etiology, tobacco associated and idiopathic. Okay? And based on extent, it is also divided into localized and diffused. Further, it is divided into based on the malignant transformation, high risk site and low risk site. High risk site, it includes floor of the mouth and the soft palate. Low risk site, it includes dorsum of the tongue and the hard palate. Now, based on this histology, it is further divided into two types, dysplastic and non-dysplastic. Okay. Please remember these classification because it is very important. Okay. Now guys, come to etiology. So, the first etiology is tobacco. It means it is commonest. The first cause or the main cause of leukoplakia is tobacco. And 80% of tobacco users develop leukoplakia. Both smoke and smokeless tobacco. Okay guys, dose and duration dependent also and cause and effect relation conferred by the studies. Tobacco chewing, it means risk of leukoplakia more increase. Okay, 60 times more increase than chewers than in non-chewers. Okay, and tobacco in smoking form, it means guys, first of all, tobacco is divided into two types. Okay, a smokeless form and a smoke form. A smokeless form, it means risk of leukoplakia 60 times more than in chewers than in non-chewers. And smoking, it means development is dose and duration dependent and old age group is higher prevalence for leukoplakia. Now the second one is alcohol. Okay, not associated with increased risk of leukoplakia development alone, acts with tobacco also. Okay, it facilitates the entry of carcinogen into exposed cells and thus alter the epithelium and its metabolism. So it's also affect and it's cause leukoplakia. Okay, affect the epithelium. Now the third one is chronic irritation. Chronic irritation, it means it includes ill-fitting dentures, etc. Okay, and the fourth one is syphilis. It means a higher incidence of leukoplakia seen in patients with syphilitic glossitis. It means guys, tongue becomes stiff and frequently has extensive dorsal leukoplakia. And the fifth one is nutritional deficiency, and the sixth is actinic radiation, and the seventh one is ultraviolet radiation, and the eighth one is galvanism, and the ninth is candida albicans. Guys, candida albicans, wait, Candida albicans is also very important. First of all, 60% nodular type and 3%. 60% nodular type and 3% homogeneous type found frequently in leukoplakic lesion, okay, and can colonize the superficial epithelium layers of the mucosa. And the last one is it is also caused by trauma. Now guys, come to clinical feature. First, clinical presentation. It means age, sex and site. Okay. Age 4th to 5th decade of life. It means mostly or commonly occur in 4th to 5th decade of life. And sex is male predilection. It means it occur more in male as compared to female. Okay. And the site is 70% buccal mucosa. It means it occur in 70% 70% cases it occur in buccal mucosa and also in floor of the mouth, palate and gingiva and lateral and ventral surface of the tongue. Now come to clinical features, sign and symptoms. So first of all, color, usually white or gray. It means it look like usually white or gray in color. Okay. And texture is thick, slightly raised and hardened surface. So in classification we know that it is divided into two types, homogeneous and non-homogeneous. So in homogeneous leukoplakia, homogeneous white patches appear in case of homogeneous leukoplakia, and low risk malignant transformation is also in homogeneous leukoplakia, and no red component, fine white and grainy texture, localized and cracked mud appearance. And one more thing, please note down, in non-homogeneous, it means interspread with red area. Okay, this is very important, please note down. And high risk of dysplasia or malignant transformation in non-homogeneous. Okay guys, now diagnosis guys, are you ready for diagnosis for leukoplakia? First is incisional biopsy. Okay. So it means investigation. First is incisional biopsy. Second one is brush biopsy. Third one is vital staining. Fourth is superficial smear. Fifth one is T palladium serology. And the sixth and the last one is molecular marker. These are the investigation we can use for leukoplakia. Okay. And now come to differential diagnosis. Differential diagnosis. It means leukoedema. It also, first of all guys, differential diagnosis of leukoplakia. The more common differential diagnosis is leukoedema and lichen planus. Okay. So leukoplakia, lichen planus, chemical burn, lupus erythematosus, white spongy nevus, these all are the differential diagnosis of leukoplakia. Now come to treatment part. Anyone know what treatment should? So let's start it. Conservative management. It means elimination of etiological factor. Eliminate all the etiological factor. It means what guys? Alcohol, tobacco, all are eliminated. Okay. And restraining from smoking or chewing tobacco. And to remove sharp broken down teeth. And also it is done by surgical excision. Okay. So guys, thank you. If you really like this video, if you have any feedback or suggestion, please let me know in comment box, which will help me to improve my video. Okay, and please like and subscribe my channel. If you want the next video and free notes, then subscribe my channel. Thank you.